Well, St. Louis area restaurants and bars have been closed their dining rooms. They have to close their dining rooms and shift to carry-out service during the coronavirus pandemic. That decision today from regional leaders, including St. Louis Mayor Lada Creason and St. Louis County Executive Sam Page. And to talk more about this, we are joined in studio by County Executive Dr. Sam Page. And just to be clear, this was a regional decision. It wasn't just St. Louis County or St. Louis City.
No, St. Louis County, St. Charles County, Franklin County, and St. Louis City.
So give me an idea of the conversations that you guys are having. It sounds like you're talking almost every single day.
Sure, we have a call every morning with the leaders of the St. Louis hospital systems and with some civic leaders and with some regional leaders as well.
Sam, I guess the big question is for how long? Everything we're hearing is that this pandemic could go on for months. If it does last that long, how many restaurants that are now closed for dine-in will still exist?
Well, this is a terrible economic impact on our small businesses and our restaurants, and it's going to take federal help to get through it. And I know that I heard today that there is a bipartisan package passing through at government at the federal level that will provide some relief. But we really don't know how long this is going to last. We know that it's new. We can see what's happened in the rest of the country and the rest of the world. But what we do know is that we have to slow down its spread. And the most important thing we can do is to implement these social distancing policies, limit social mixing, and slow down the spread in our community so it doesn't hit all at once.
But if it does last long, how long can we sustain these draconian measures? Because schools are closed. I mean,
Right.
There's no theaters, there's no ball games. People have to be staying in their homes. How long can that go on?
Well, it will go on as long as it has to. It may be a few weeks, it may be a few months. I suspect it'll be measured more in weeks, but it's hard to say. We know what we have to do. We have to slow down the spread. We have to implement these social distancing policies and try and avoid a big peak and have all of the disease, all the COVID-19 infections hit at the same time. That would be very difficult for our hospital systems.
You mentioned the possible relief package from the federal government.
Right.
Is there anything local government can do to provide some relief for these restaurant workers, hospitality workers, et cetera?
Sure. Well, the job of local government really is to deliver the critical services in an emergency situation. And we're really there in our community. This is manageable, and there will be water, there will be food. The grocery stores have plenty of food. There's no need to hoard food. But it is a complete change in our lifestyle. It is a complete change in how we conduct our daily lives. But we have to make these changes.
There are many areas around the country that have drive-through testing for
Right.
COVID-19, but the line can go for miles. Where are we in terms of testing capacity in the region?
Well, our hospital systems are working very well together in coordinating those. SSM, BJC, and Mercy will all have sites throughout St. Louis City, St. Louis County, and St. Charles County, and those sites will all be up and operational by Friday.
And what about hospital beds? If this thing starts to overwhelm the county, the region, are we prepared to possibly move hospital beds into, say, dorms or other places?
Well, we may end up using some dormitories for people that are in isolation. I mean, that's a possibility. It depends on how quickly we can adopt our social distancing policies and implement some of these social mixing restrictions and slow down the spread of this virus. We're a little bit ahead of the rest of the country right now. We've learned from the experience of the other parts of the coast, the other parts of the country, and we can slow this down if we work together. We're serious about these changes in our lifestyles and these changes in our behaviors.
Can you talk about the people on the front lines, the healthcare workers, the doctors, the nurses, the first responders? You're a doctor. You know what they do every single day. I saw tonight where there's 2 U.S. doctors who are in critical condition after treating coronavirus. Just talk a little bit about these doctors and nurses and the job that they're doing.
Well, we don't traditionally look at our doctors and nurses as first responders, but in a situation when you have a worldwide pandemic and this infection is spreading through our community, that's what they are, and we have to recognize that they are on the front lines. They do put their lives at risk to take care of patients, and I'm especially impressed with nurses who volunteered to go out and perform the testing in their full isolation garb to protect themselves, but also to try and take care of members of our community.
Well, Dr. Page, we really appreciate you being here tonight to answer some of these questions, and I'm sure we're going to have more in the days to come. Dr.
you.
Sam Page, a graphic that's gone